very extensive studies. I was thinking about the high radiation doses, extremely high, and there is no side effect or I mean, as a radiobiologist, I never see such high radiation doses.
And that will be the cut-off we aim to achieve. Now we are increasingly confident that SERT is relatively safe because, as I've mentioned, the tumor mainly derive blood supply from the hepatic artery. That's why when we try to inject the spheres through the artery, most of them actually would go to the tumor. Of course, it needs technique, okay? Not everyone can do SERT. I think not everyone are experienced enough to do SERT, I would say. But still, when the sphere can be delivered to the tumor, for example, as I've mentioned, the effective treatment range of the sphere is only a few millimeters, and most of the normal tissue could be spared, therefore. And that's why if we can be confident to deliver the sphere to a tumor, I'm sure this is overall a safe treatment. And also there's also numerous studies showing that it can be used as a bridge to transplantation, especially in Canada, because in Canada the waiting time is as long as in Hong Kong. So most of them would have gone through SERT as a bridge to transplantation to try to give them more time to wait for cadaveric donors.
That was very attractive.
Yeah.
You can use these high radiation dose very locally. That is very good.
Yes. Unfortunately, microspheres is only limited to treating liver tumors. Of course, we have evidence to show that it can be treated for colorectal liver metastasis from, say, for example, from breast cancer or cholangiocarcinoma. We have ongoing study to treat intrahepatic cholangiocarcinomas and also for the neuroendocrine tumors. But unlike liver, for the rest of the organs, most of them only have one blood supply. That means from the artery itself. You know, portal vein is not present everywhere. Okay, it's only present from the intestine to the liver. So that's why, unfortunately, still this kind of treatment is limited to the liver itself, and it had minimal effect on the extrahepatic disease. Actually, most of these patients would fail in extrahepatic regions, I would say, just what I've mentioned. And that's why systemic therapy is also very important in this scenario.
Can you tell me how much?
In Hong Kong, for example, a typical treatment done in private is probably around 300,000 to 400,000 Hong Kong dollars, depending on hospital charges, doctor charges. Yeah, I would say.
So how many patients can have? Is it limited to few patients?
Well, I would say in the past year I usually have around 2 to 3 cases per month, I would say. Yeah. In the past, because in the past I'm working in a private hospital, there may be more referrals, I would say. So I was because in the past, previously I worked in Baptist Hospital. See, they have no such service. After I went there, they start to have this kind of treatment. Now I would say in the past I think they will have around 20 cases per year. I would say 20 to 30 cases.
The patient paid by himself?
Yeah, or by insurance. Yeah. Of course,
we should be a rich patient to be able to have this treatment.
Well, I think unfortunately, even for systemic treatment, it's not cheap at all. When you look at the prices, say of regorafenib, nivolumab, or pembrolizumab, they would cost you probably around 40 to 50,000 per month as well. When you think, for example, you receive 3 to 4 months of treatment, actually the treatment cost is actually quite similar, I would say. And also I have to stress that this This surface is also available in our public hospital. Unfortunately, they have limited indication. They will only consider for those cases who have tumor larger 8 centimeters, for example, or with major photoinvasion. So that would limit the use in other areas, I would say.
Thank you very much.
Thank you.
Maybe there's some